This presentation will provide an overview of intellectual disabilities, or ID. In this presentation, you will learn about the history of intellectual disabilities, definitions of intellectual disabilities, prevalence and causes, characteristics of students with intellectual disabilities, and best practices for educating students with intellectual disabilities. Our nation and our world has come a long way in our identification of individuals with intellectual disabilities and in the manner in which we support these individuals to become full participants and contributors to society. We have had a long history of segregation and isolation behind us in regards to how we supported individuals with ID, but we are now focusing on the inclusion of individuals with intellectual disabilities across home, school, and community settings. There are many terms used to describe individuals with intellectual disabilities, and these have included the terms mental retardation, cognitive disabilities, and cognitive impairment. All of these different terms are synonymous, but the most commonly used term is intellectual disabilities. Because of the negative connotation of the term retardation, we use the term intellectual disabilities across the U.S. and the world. Unfortunately, the federal definition of ID is currently under the term mental retardation. And in federal special ed law, in IDEA, it is described in the following way. The student would have significantly sub-average general intellectual functioning, existing concurrently with deficits in adaptive behavior, and manifested during the developmental period. In other words, students with ID have lower IQs and deficits with adaptive behavior, which we'll discuss in a little bit, and all of this is manifested in the developmental period or the early stages of life. There are 4 criteria used to identify students with ID using the federal definition described on the previous slide. First, students would have an IQ of 70 to 75 or below. They would have deficits in adaptive behavior, which adaptive behavior consists of conceptual, practical, and social skills that students use to function effectively in their everyday lives. The intellectual disability must be manifested before the age of 18 during the developmental period, and it must adversely affect the student's educational performance. The American Association on Intellectual and Developmental Disabilities, or AAIDD, is the leading professional organization dedicating to promoting progressive policies, sound research, effective practices, and human rights for people with ID. The link provided here will bring you to a video that will give you a better understanding of the definition of ID and does a really good job at describing what adaptive behavior actually means in applied context. There are different levels of intellectual disability based on the student's IQ. Students with mild intellectual disabilities would have an IQ ranging from about 50 to 75. Students with moderate intellectual disabilities would have an IQ ranging from 35 to 55. Students with severe ID would have an IQ between 20 and 40, and students with profound ID would have IQs below 25. Approximately 0.76% of the school-age population is classified as having ID. Of these children, 70 to 85% have mild to moderate ID. The number of students with ID declined by approximately 18% between 1998 and 2007. This is likely due to efforts to avoid inappropriate overrepresentation of students from culturally diverse backgrounds as having ID. We also have identified higher functioning students with learning disabilities because it is less stigmatizing, and the positive effects of early intervention efforts have resulted in fewer students becoming identified with ID later on in school. It's important to note that African American students have been significantly overrepresented in the ID category since the 1960s. If you remember back from the module on the legal foundations of special education, The Larry P. versus Riles case addressed this factor in that it was determined that it would be illegal to place an African American student in special education purely due to an IQ score. Um, students with students who are African American are more than twice as likely to be identified with intellectual disability as statistical data would predict, meaning they're being over-identified as having ID, but statistically that should not be occurring. For almost all students with mild intellectual disabilities, we do not know the particular cause. We do know that many of these students come from families who live in poverty and from minority groups. Risk factors that may exist in high poverty settings include inadequate housing, nutrition, and health care, as well as limited family resources, the number of children in the family, the mental health and educational level of the parents, and the family's flexibility in addressing the children's needs can all be factors that lead to the development of an intellectual disability. In contrast, we often do know the cause of more severe intellectual disabilities, and these causes could be prenatal, perinatal, or postnatal. Prenatal causes include things such as alcohol and drug abuse, malnutrition, exposure to environmental toxins, maternal illness, genetic conditions, and chromosomal abnormalities. Perinatal, or this means during birth, causes could be prematurity or low birth weight, difficulties during delivery such as birth injuries or oxygen deprivation. And then postnatal or after birth causes could be infections, injuries, and exposure to environmental toxins. The primary areas of impairment for students with ID include cognitive and academic impairments, social impairments, communication impairments, and physical impairments. In relation to cognitive and academic characteristics, many students with ID can learn basic literacy and functional mathematical skills, but have difficulty with more advanced skills. This is often a result of cognitive deficits in attention, in memory, and in generalization. Generalization means the ability to take skills that they've learned and to apply them in a variety of different ways. As far as communication characteristics, some students with ID are highly verbal with fairly mild communication difficulties, while others can have severe communication impairments and may be minimally verbal or even nonverbal. These students may compensate for their lack of verbal communication skills with the use of nonverbal behaviors, such as eye contact, facial expressions, gestures, etc. However, we must provide interventions to teach these students how to communicate using augmentative communication tools and devices. While students with ID often enjoy socially interacting with peers and adults, they typically have difficulty demonstrating appropriate social behaviors. These students may have difficulty knowing when and how to initiate social interaction with others in an appropriate manner. However, with their social skills, when their social skills improve and they receive effective intervention, they can have varied opportunities to interact with their typically developing peers and be successful. Students with ID often have serious medical or physical conditions. Cerebral palsy and epilepsy are two conditions that are often present in students with ID. And for more information on cerebral palsy, there is a link here for you to click on, as well as a link for you to click on for more information related to epilepsy. They may also have medical conditions such as gastrointestinal disorders, inadequate ventilation of lungs, kidney and heart problems, sensory problems, and frequent infections. To learn more about syndromes associated with intellectual disabilities, there are links provided here. So there is a link for you to learn more about Down syndrome, fetal alcohol syndrome, Prader-Willi syndrome, Angelman syndrome, Williams syndrome, and Fragile X syndrome. There are a variety of best practices that teachers can use when working with students with ID in classroom settings. One thing to do is to always promote the development of self-determination skills. Self-determination skills mean that the student is able to identify their own unique strengths, interests, and their unique needs. They're able to set goals for themselves and monitor their own progress, and they're able to make meaningful choices across their life. Another thing we want to use when teaching students with ID is direct, systematic, explicit instruction to teach new skills. There is a module on systematic instruction that explains how to do this. We also need to use assisted technology to help with any physical needs and/or communication needs. You will need to differentiate your instruction using principles of universal design for learning so that we learn how to modify instruction in the general ed classroom so it is appropriate for the students' performance levels. The use of task analysis and chaining are very important for students with ID because it helps them break tasks down and skills down and helps provide the supports they need to learn in a stepwise fashion. And there is a module on task analysis that teaches you how to use that strategy. Using applied behavior analysis teaching approaches is also important, including the ABC teaching sequence, using prompting fading procedures, and using shaping. And finally, providing many opportunities for repeated practice. Because students with intellectual disabilities have difficulties with memory, it's important to provide extensive levels of repeated practice to move the child from the skill acquisition level where they're learning something to the fluency level where they're able to demonstrate that skill consistently without error. Eventually, we move them to maintenance where they're able to maintain that skill that they've learned over time, and then finally to generalization where they're able to use that skill across settings in a variety of different ways. So the best way to move a student towards generalization is to first provide repeated practice at the skill acquisition and fluency levels, and then plan opportunities for the students to use those skills in a variety of different ways.